Hi everyone, it's Christopher Kelly here from Nourish Balance Thrive. I wanted to talk to you today about DHEA and what it has to do with adrenal fatigue and how you can use it as a supplement. So, first of all, what the heck is DHEA? It's a steroid hormone and a precursor to most of the other sex hormones like estrogen and testosterone. And studies have shown that it naturally declines with age, but I'm going to propose another mechanism that might be leading to it getting lower than it should be. Now, one thing to bear in mind about DHEA is it is on the WADA banned substance list. So if you're an athlete that's likely to get tested, then you cannot take DHEA as a supplement. Now, suboptimal levels of DHEA have been associated with many age-related degenerative conditions, including chronic inflammation, low libido, rheumatoid arthritis, cognitive decline. It's really not something you want. And, in the 90s, it was touted as this fountain of youth. And I'm not really sure that any of those claims that were made then have really come to fruition. But I think it's also worth bearing in mind that because it's a naturally occurring molecule in the body, that nobody can hold a patent to it, right? So Pfizer can't come along and make $1 billion out of this because you just can't hold a patent. Oops. So let me show you this chart, which again looks quite scary, but isn't really. When you look at the top right, you'll see there's this molecule pregnenolone, which you can think of as the precursor to all steroid hormones. And if you look directly below pregnenolone, you'll see DHEA there. And if you look beyond that, below that, you'll see that there's estrogen and testosterone. And so you can see that DHEA is a really important precursor. And then if you were to see low DHEA, then it would be reasonable to assume that testosterone and estrogen especially would also be low. Now, about this proposed mechanism for getting to the point where you've got low DHEA, I think that chronic stress is involved. And the red arrows on this chart illustrate what I mean. So if you look at cortisol, which is in the bottom left of this chart, you'll see that it's the primary hormone of the stress response. And if you were being chased by a tiger, then it would make much more sense to produce this stress hormone than it would to produce this hormone that's a precursor for all of the hormones that are used to making babies, right? So if you're about to be eaten by a tiger, then now's not the time to be making babies. So I think that chronic stress and the overproduction of cortisol is somehow related to the lowering of DHEA. And that's certainly what I've seen on the lab test. So let me show you one of those. This is a BioHealth 205 adrenal stress profile. It's a saliva test. So you just spit into the tubes. And one of the numbers that comes back on this report is DHEA. So you can see there's 4 cortisol readings. I've talked about that before in a previous video. But the DHEA, you can see there, it's 1.31 on this lab. And the reference range is just the average of all the numbers the lab has ever seen. I think they're actually mandated by law to report them in this way for this particular test. And so you think about the type of person that would do this test, it's someone that's not feeling great, or at least they're looking to achieve better performance. So they at least believe they can be doing better. And for this reason, I see very low DHEA quite often just because these people aren't feeling good. So in this case, 1.31 is extremely low. Ideally, they'd be an 8, 9 or a 10. That's what I've seen to be optimal. That's what I've been taught is optimal. And that's how I've felt personally have known an optimal level of DHEA. So if you look on page 2 of this adrenal stress profile, you see there's lots of other numbers. And one I think that's particularly interesting on here is estrogen. So we've already seen on that previous chart that estrogen is a metabolite of DHEA. So DHEA is used to make estrogen. And in this case, this woman has extremely low estrogen. So you'd expect to see this between maybe 2, 3, 4, even 5 or 6 points would be normal for a woman of this age. And actually she's a 0.8. So that's kind of consistent. And the same is true of the testosterone. The testosterone should be 50. It's not, it's 37. And so I've seen hundreds of these now, and they always follow this pattern. That's not quite true, actually. You do see some exceptions, but they nearly always follow this pattern. where you see low levels of the metabolites in conjunction with the low levels of DHEA. So once you've done the test, and I would insist that you always do the test before establishing whether you can benefit from supplementation or not. How do you take the supplement? Now, there's some problems with supplementation, not least of which is the banned substance list issue. But beyond that, the most common way that people take this as a supplement is through an oral tablet. So it's not the end of the world if that's the only way that you can take this as a supplement, but I would suggest that there's a better way. So the problem with the tablet is you don't really know how much you're actually going to absorb. Your digestion is in the process, and the hormones are metabolized differently, and every person is going to be different and absorb a different amount, and so it's going to be very difficult to calculate the dose using a tablet. Now, the second way that I sometimes see is using creams. And I think the creams also have a problem that's kind of similar in nature, in that it's very difficult to calculate the dose. So when you rub a cream onto your skin, the first thing that's going to happen, or over time what's going to happen, is it will super saturate into the subcutaneous fat. And then at which point you don't really know how much is really going to be released into the bloodstream. So again, it's very difficult to calculate the dose. So the way that I prefer is using sublingual drops. So this bottle that you can see here in front of you, there's a pipette and there's a glass dropper in it. And what you do is you just drop these drops of liquid underneath your tongue. And because it's in an alcohol glycerol solution, the molecule of DHEA is actually forced across the cell membrane exactly like an injection. So not only can you calculate a dose very precisely, and in some cases the dose is extremely small, it really depends on the result of the saliva tests, you can also see very quick response. So if you're really deficient in DHEA, you can see quite a powerful and fast response by taking the supplement in this liquid form that goes underneath your tongue. So I hope this has been helpful. I should point out that this is not the only way to skin a cat, right? So if your problem is low cortisol, low DHEA, then there are other things you can do in terms of supplements that can raise DHEA. So this is not the only way, but it's a really good way that I've seen work very well in the past. So if you'd like to know more about the test and the supplements, you can head over to my website. It's nourishbalancethrive.com, and there's lots more information there. Thanks for listening. Bye.